And as we think about the social determinants, we know that there's a strong correlation between those social determinants and actual health outcomes. And so that's what this program is really designed to do, is how can we address the social determinants? How can we bring holistic care to these members who we're touching in multiple parts of our various cabinets and agencies, and get those resources aligned towards a common end?
So if you look at what actually determines our health outcomes, 20% approximately comes from your actual access to care and the quality of that clinical care. About 30% can be attributed to healthy behaviors and getting your exercise, eating right, getting your checkups. And about 40% is actually linked to your social and economic factors. It's those social determinants, again, that Adam referred to. It's your connections, your network, your interacting with other people around you and having something that gives you meaning and purpose. So, we believe that this model really shows access by itself is not going to give the answer for improving healthcare and health outcomes.
Just as an example, an anecdote, when we came in at our expansion population and we started looking at the data to see what are the effects, what are the long-term implications of providing access. And what we found was 1 in 10 of our expansion population actually got a preventive wellness visit with a primary care physician, for example. It's even lower than that for preventive care for dental and vision. And so we weren't seeing the kind of changes in utilization that would lead to long-term changes in better health outcomes. And so another focus area is really trying to drive that utilization of preventive care, getting them connected with a primary care physician, getting them to go to those annual wellness visits. And so you'll see as we talk about some of the ways we're looking to incentivize those changes in behavior to really drive those healthy behaviors and the better use of clinical care. The My Rewards account is our health incentive account. So this is how we are going to, one of the ways that we'll try to incentivize members to do things that increase their healthy behaviors. So things like smoking cessation classes or some of the public health programs like the HANDS program that we have. These are all types of things that we will incentivize.
For example, our traditional Medicaid adults who were eligible before expansion happened, they will continue to have their same benefits. They will have either a premium payment or a copay. It's not both. No change in benefits, and they'll continue to get their vision and dental through their managed care organization. And they may have a community engagement requirement unless they are a primary caregiver of a dependent child. So that's our traditional Medicaid adults who are eligible before expansion. For pregnant women and children, and these are our traditional Medicaid and K-CHIP members, they have no changes. They will have no premiums, no change in benefits, and there will not be a community engagement requirement for pregnant women and children. Medically frail adults and former foster youth to age 26 on the bottom right, these groups of individuals will have optional premiums. They'll have the option to pay a premium to get access to the My Rewards account. They will not have a change in benefits, so they'll still get their vision and dental through their MCO, and they do not have a community engagement requirement. I would like to point out, though, that even if someone does not have a community engagement requirement, we are making resources at our career centers and through our adult ed programs available to anybody who wants to access them. So there may not be a requirement, but these resources will be open to anyone who'd like to go to those facilities and those resources. The Medicaid expansion adult group, this is the group that will see the most significant number of changes to their Medicaid benefits. We have 485,000 individuals currently as part of our expansion group who are known to us, who we have access to, who we have interactions with, and this is an opportunity for us to continue to incentivize preventive behavior. So the Medicaid expansion adults represent that group. They will have either a premium payment or a copayment. They have a plan that's very similar to the state employee benefit plan. So they have their health insurance through one avenue, and that is through Kentucky Health. And then their vision and dental, routine vision and dental benefits will be through what's called the My Rewards account, and it is a health spending-like account. And through healthy behaviors, like Adam said, healthy behaviors and different classes they can take that all encourage health and prevention and education and personal development, they can earn virtual dollars into that My Rewards account. And then there is a community engagement requirement for these individuals unless they're a primary caregiver or have another exemption from community engagement.
We're going to be doing one county starting July 1st, Campbell County in northern Kentucky. We'll then go over to Boone County in August, and then Kenton County in September. So we're going to do one county for the first 3 months. That'll allow us to concentrate resources, get best practices, any lessons learned, reincorporate that feedback into the broader rollout, which will start October 1st.